بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is about mesenteric adenitis. What is mesenteric adenitis? It is a self-limited inflammation of mesenteric lymph node, usually occurring in the right lower quadrant, and the patient with this presentation can mimic appendicitis, and also the patient presented with focal abdominal pain, fever, and leukocytosis. Here, patient with right upper quadrant pain with mesenteric lymphadenitis. What we see in this axial CT scan contrast, this is the cecum and this is the appendix. Normal appendix filled with contrast, and there are multiple small enlarged mesenteric lymph node in the right lower quadrant. And also here, this is the cecum and this is the appendix and a small enlarged lymph node on the right lower quadrant. As we see here, there is no inflammatory changes around the cecum. This excludes diverticulitis, and also there is no inflammatory changes around the appendix, and the appendix is filled with contrast, so this excludes appendicitis. And also there is another differential diagnosis is a tumor or lymph tumor in the surrounding structures. There is no suggestive of tumor in the surrounding structure in this patient. So this multiple lymphadenopathy, mesenteric lymphadenopathy with normal appendix and no inflammatory changes around the cecum, consistent with mesenteric adenitis. Crohn's disease sometimes presented with mesenteric lymphadenopathy, but there should be wall thickening in the adjacent terminal ileum and also sometimes in the cecum, and it is not in this case. So this is a mesenteric lymphadenitis presented with multiple enlarged lymph node with normal appendix and no pericecal inflammatory changes. So we exclude appendicitis and we exclude diverticulitis and Crohn's disease in this patient. Thank you very much for listening, and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.